Breastfeeding your toddler can be a beautiful journey, full of cuddles, connection, and comfort. You have likely overcome many early challenges to build this special bond. So, when your sweet child suddenly bites down during a peaceful nursing session, the shock and pain can feel overwhelming. It is important to know that you are not alone in this experience. Many mothers face this temporary phase, and it can be very upsetting. The sudden, sharp pain can make you want to stop breastfeeding altogether. Remember that this behavior is not a sign of rejection or aggression from your child. It is simply a form of communication that we need to understand and gently redirect. Your first reaction might be to yelp in pain and pull away, which is completely natural. However, understanding the why behind the bite is the first step towards solving the problem. A toddler cannot bite you while they are actively and correctly latched for nursing. This is because their tongue covers their bottom teeth and gums to draw milk from the breast. Biting usually happens at the very beginning, or more often, toward the end of a feeding session when they are no longer focused on drinking. Knowing this can help you become more aware of when a bite is most likely to occur, giving you a chance to prevent it before it happens. This biting phase is almost always a temporary issue that can be managed with patience and consistent, gentle responses. It does not mean your breastfeeding journey has to end. Your toddler is not trying to hurt you on purpose or tell you they want to wean. They are often just experimenting with their new teeth, feeling discomfort from teething, or trying to get your attention for a moment. By learning to read their cues and teaching them that biting is not acceptable, you can move past this difficult stage. It is a bump in the road, not the end of the journey. Think of this as a new communication challenge you and your child will solve together. Just as you learn to understand their early hunger cues, you can now learn to anticipate the signs that might lead to a bite. This might include a change in their sucking pattern, a mischievous look in their eye, or wiggling and seeming distracted. By paying close attention, you can protect yourself from pain and teach your little one a valuable lesson about gentle behavior. Your bond is strong enough to handle this, and with the right tools, you will both come through it with your nursing relationship intact and stronger than before. One of the most common reasons a toddler bites during breastfeeding is teething. The pressure of new teeth pushing through their sensitive gums can be very painful. To relieve this discomfort, they might instinctively bite down on whatever is in their mouth, and sometimes that is you. You might notice your child is drooling more, is fussier than usual, or is trying to chew on their hands, toys, or anything else they can find. The pressure from biting provides a counterpressure that can temporarily soothe their sore gums. Offering a cold, wet washcloth or a safe teething toy before a nursing session can sometimes satisfy this need to chew and prevent a bite. Another frequent trigger for biting is simple distraction or boredom. As toddlers grow, their curiosity about the world around them explodes. An older sibling running through the room, the television playing in the background, or even a new toy can capture their attention mid-feed. When their focus shifts, their latch can become shallow, and they might forget they are supposed to be nursing, leading to a clampdown. This often happens at the end of a feed when their tummy is getting full, and their interest in nursing is waning. Watching for these signs of distraction can be your cue to gently end the session before a bite occurs. Sometimes a bite is a powerful, albeit painful way for your toddler to get your undivided attention. In our busy lives, it is easy to get distracted while nursing. You might be scrolling on your phone, talking to someone else, or thinking about your to-do list. Your clever toddler may learn that a quick bite is a guaranteed way to bring your full focus right back to them. This is not malicious. It is a simple cause and effect lesson for them. If they feel your attention has drifted away, a bite certainly gets it back. Making an effort to maintain eye contact and talk softly to your child during feeds can help them feel connected and secure, reducing their need to bite for attention. Finally, some toddlers bite as a form of play or experimentation. They are learning about how their body works, and their new teeth are a fascinating addition. They might bite down simply to see what happens or to test your reaction. It is a form of exploration, like when they drop a spoon from their high chair over and over again. They are not trying to be mean, they are just being little scientists. Understanding these common triggers, teething pain, distraction, a need for connection, or simple curiosity, is key. It allows you to respond with empathy and use strategies that address the root cause of the behavior rather than just reacting to the pain. When a bite happens, your immediate reaction is important for teaching your child that this behavior is not okay. While your instinct might be to cry out and pull your toddler off, this can sometimes scare your child or even seem like a fun, dramatic game. A more effective approach is to stay as calm as possible. Firmly but quietly say, "No biting. Biting hurts mommy." Then, use your finger to gently break the suction at the corner of their mouth and remove them from the breast. Putting them down on the floor for a brief moment, just 15 to 30 seconds, reinforces the message. This shows them that when they bite, the fun, cuddly nursing time stops immediately. Consistency is absolutely essential. You must respond in the same calm, firm way every single time a bite occurs. If you sometimes ignore it and other times have a big reaction, your toddler will get mixed messages, and the behavior is likely to continue. The goal is to create a clear and predictable consequence. Biting means breastfeeding ends, at least for a minute. After the brief pause, you can offer to let them nurse again. Say something like, "Do you want to nurse nicely? No biting." This gives them a chance to try again and learn the correct way to behave while breastfeeding. Prevention is even better than reaction. Pay close attention to your toddler's nursing patterns. As mentioned, biting often happens when they are no longer actively feeding. Watch for a change in their jaw movements or when their sucking slows down and becomes more fluttery. When you sense they are nearing the end of the feed or getting distracted, be ready to gently unlatch them before they have a chance to bite. You can keep your finger near the corner of their mouth, ready to break the seal. This proactive approach protects you from pain and prevents your child from practicing the unwanted behavior, making it easier to stop. If your toddler bites and latches on tightly, pulling them away will only increase the pain and can cause damage to your nipple. Instead of pulling, pull them in closer to you. Press their face gently but firmly into your breast for a second or two. This will momentarily cover their nose and make it difficult for them to breathe, forcing them to open their mouth to gasp for air. It sounds counterintuitive, but it is a quick and effective way to make them release their jaw without hurting either of you. Then, you can proceed with the calm no biting message and a brief pause from nursing. Dealing with biting can be emotionally and physically draining, but it is vital to work on healing both your body and your nursing relationship. If a bite has broken the skin, be sure to care for your nipple to prevent infection. Gently wash the area with mild soap and water, pat it dry, and apply some expressed breast milk or a purified lanolin cream to promote healing. If you are in a lot of pain, it is okay to offer the less sore breast first at the next feeding. Taking care of yourself is not selfish. It is necessary so you can continue to care for your child and feel positive about breastfeeding again. Rebuilding trust and positive feelings around nursing is just as important. After a biting incident, try to make the next nursing session as positive and connected as possible. Find a quiet, calm space with few distractions. Cuddle your toddler, make eye contact, and speak to them in a soft, loving voice before you offer the breast. Remind them we are going to nurse gently. This helps reset the tone and reinforces that breastfeeding is a time for love and closeness, not pain. Focusing on the positive connection reminds both of you why this relationship is so special and worth preserving through this challenging phase. Please be kind to yourself during this time. It is normal to feel anxious, angry, or even afraid to breastfeed after being bitten. These feelings are valid. Talk to your partner, a trusted friend, or a lactation consultant who can offer support and remind you that this is a common and solvable problem. You are not failing as a mother. This is a developmental stage, and like all stages, it will pass. Your patience and gentle guidance are teaching your child an important lesson about empathy and boundaries, which is a gift that extends far beyond breastfeeding. Your efforts are valuable and you are doing a great job. Remember the incredible benefits that extended breastfeeding provides for both you and your toddler. It continues to be a wonderful source of nutrition, immune protection, and emotional comfort. This biting phase can feel like a major roadblock, but for most families, it is a temporary one that can be overcome with consistent, gentle strategies. Do not let this challenge overshadow the months or years of beautiful connection you have built. Trust in your bond, trust in your ability to teach your child, and know that you can move past this together, continuing your breastfeeding journey for as long as you both wish.